Have you been dealing with spider or varicose veins for years now? Well, maybe it's time to do something about them, and I know just the people to help you. Dr. Norman and Maria Bein from Vein. I have not done that, ever. Dr. Norman and Maria Bein from St. Louis, Vein Specialties here to show you a couple of treatment options. Welcome back to the show.
We finally got it right.
It's always a pleasure. I've known you for years. I've never said that. Welcome back. It's good to see you again.
Good morning. Thank you very much. Always a pleasure.
Let's talk varicose veins. First of all, what are they and what's the trouble with them?
Varicose veins are heredity. They do not come from your work. They do not come from anything other than something you've inherited from mom or dad or grandparents. These are treatable. The correct treatment these days is laser treatment in office, not in hospital. It has to be done by someone who knows what he's doing. You have to do it right the first time. Good enough never is. We do perfect vein surgery in our office, and we've done thousands of cases with everybody very pleased.
And Maria, it's not covered by insurance, but people have these and they want to deal with them.
Actually, varicose veins, if you have symptoms, pain, aching, heaviness, then insurance will cover them. But we do the insurance for you. We advocate for our patients.
And then spider veins, I jumped ahead of myself. Spider veins, talk to me about those and then the insurance issue with those.
I think Maria's good at that.
Take it away. Take it away, dear. Take it away.
I do a lot of the spider vein treatments in the office, and they are considered cosmetic, and no insurance pays for them.
But again, if you have them and you just don't like the look. You're not wearing skirts. You're in the summer. There's no way you're going to be in shorts because of them. So it's worth dealing with.
Well, that's why at this time of the year is perfect, because it is a series of treatments. They do look a little worse before they look better, and you do wear compression hose like I'm wearing.
Those are compression hose?
Yes, they are.
Well, why aren't we talking about those hoses?
Yes.
Can we get? I don't know if we can get a close shot of this, but those are actually. I just never saw them look like that.
Yeah, these are new. These are called Allure, and they're wonderful. They come in a beautiful blue. They come in a neutral and a gray.
Hold on, my mouth is open. Let me close my mouth. Those are gorgeous.
Yeah. You're talking about the legs, right?
No. Hey, you're talking about the legs. We have some before and after for people to get an understanding. Yeah. You've wondered what's wrong with your legs. Talk to me about that.
These are the varicose veins, and as you see, without stitches, without any cutting, what we've done here on the local anesthesia, there's another picture of another patient that is all done with laser. We close the saphenous vein, and there, afterwards, all of these veins will disappear. Most importantly, aside from the beautiful results that you get, the heaviness, aching, the tired, that goes away. I think what's important to understand that as a surgical office, we're evaluating you down to the deepest part of your problem and not dealing with a superficial issue on a superficial basis. We make sure that you get the correct treatment for your presenting problem.
And these are spider veins we're looking at here.
These are spider veins, and we try to get a series of treatments in and treating veins that are underneath that area, getting again to the deepest part of the problem.
We know that every time you're on, people do call because they do want to deal with the spider or varicose veins. But what actually happens at the screenings?
St. Louis is a very generous city. We give back by offering free screenings. We do this several times a year. The problem is getting everybody in, which is why these different screenings that we do fill up rapidly. I recommend if anybody knows anybody or has a problem that they do come in. What we do, this is not a lecture, this is not a group session. Every patient that we see is seen by me personally. An ultrasound is done, an evaluation of the deep system, the superficial system is all performed in at least a 15-minute evaluation, at the end of which all of your options will be known to you. Everything will be presented to you, and you'll walk out of there with the correct information to make an intelligent decision.
And so the question you have now is, when are those free screenings? January 12th in Creve Court, their office there, and then January 26th at their office in Washington, Missouri. If you are interested, give Dr. Norman a call. I'm calling him Dr. Norman now. The number for St. Louis Vein Specialties is 314-993-8233 or 866-626-VEIN. Thank you both. So good to see you.
Merry Christmas.
Merry Christmas to you. All right, Virginia.